Hello again, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and as usual, we're coming to you from our Hazleton location. That's 281 Airport Road in Hazleton. And again, if there's any questions, comments, or concerns, you can always give us a call. Our number is 570-453-2020. You can catch us on the web, and we're going to have a new website up and running by the time you're seeing this, folks, and that's www.drkislan.com. And for our viewers out in the Stroudsburg area, out in the lovely Poconos, Stroudsburg Eye Specialist, and our number out there, 421-3342, and we're at 852 North 9th Street in Stroudsburg. So again, if there's any questions, please feel free to give us a call. Folks, what I wanted to do today, on Eyecare Today, we like to always bring the most up-to-date technology, testing that's available to help patients as far as their eyesight goes. And what we're always concerned about, one of the conditions that I see constantly throughout the day, is macular degeneration. And we know how devastating vision loss can be from macular degeneration. Especially when a patient first gets the diagnosis, there's a lot of unknowns. We don't know a lot about the disease. We're learning more. But one of the questions is it going to get worse? How am I going to know it's going to get worse? And what the heck can I do to keep my vision from getting worse? Well, now there's some help out there. And what's become very prominent in not just eye care, but actually in medicine in general, is genetic testing. And now we have the ability to predict for patients what may happen with their macular degeneration. And I'm very happy to be joined by David Skalky. He represents a company called Macula Risk, and they've developed this genetic testing test. And we're going to discuss with you folks today how this test works, why it works, the benefits, and everything involved with this test. So Dave, thanks for joining us today and sharing your insights with the folks in our viewing area. Let's talk a little bit first just about macular degeneration, and I've pounded this message home before on other shows, but I think it's important that folks out there really understand from your standpoint, working with a company that deals with statistics and deals with all these testing. Give the folks out there an idea, first of all, with macular degeneration, how many people suffer from it in the United States?
Well, this is an age-related disease, and I think that, once a patient, goes over the age of 60 years old, usually it's 1 in 10, all right? And as they approach 70, it's 1 in 4. So this is a very prevalent disease out there that happens to patients as they start getting older. We use smoking and age and genetics to determine a patient's risk factor.
Okay. And we're going to get into the risk factors in a little bit, folks, but what macular degeneration is, and let me just kind of hit on this because those are big numbers, 1 in 10, and then as we get into our 70s, 1 in 4, those are big numbers. So when you go to the eye doctor, and if your eye care practitioner tells you that you have the early starts of macular degeneration, what exactly is happening is the back of the eye or the retina is starting to degenerate, exactly like it says, and not work as good as it did when we were younger. What happens, there's 2 forms of macular degeneration. There's what's called the dry form of macular degeneration, which is really the most prevalent form, and that's really the more slowly progressive disease. That's the one that's most common. It may change very slowly over time. Some patients it doesn't change at all, but it can convert to what's called the wet form of macular degeneration. And the wet form is really, folks, the most devastating form. That's where there's actually bleeding in the retina, and that bleeding can be extremely devastating for vision. And that's where I think this test, Dave, comes into play, because we can take a patient who we've diagnosed with early dry macular degeneration and now give them a statistical analysis and prediction of what are their risks, what's their risk for it basically getting worse. And so why is that important?
Well, it's important because if you have 10 patients in your office that have AMD, macular degeneration, and we know statistically that one of them is going to go wet, and one of them is going to have severe vision loss. They're going to advance to the more severe form of the disease. But as a doctor, you really don't know which one of those patients is going to go wet. This test, by really looking at their genetics, can help you identify which one of those patients will go wet. And by stratifying these patients into 5 different risk categories, we can look at those upper 3 categories, the higher risk patients, and you can see them more frequently. You can recommend supplements for them, and you can catch those patients as they're developing the more severe form of the disease.
Okay. So, it becomes extremely important, not only from a diagnosis standpoint now, but helping a patient understand the disease, how it's going to progress, and what's going to happen at that point. So you brought up a couple good points, what we can do to help them once we've diagnosed it and with the prediction. Obviously, there's treatments for the wet form. There's injections. There's 3 medicines now that can actually be injected into the eye to help slow down the wet form of macular degeneration. There's nutritional supplementation, which, folks, I know you've seen me talk about before. I've hammered that message home, how important those nutritional supplements are. So there are some things we can do if we see that a patient is going to be at a higher risk for getting worse in the future. Changing diet. Diet's extremely important. Smoking. Tell me a little bit about the risks of smoking. What does smoking play into this whole?
That's a really good question. Smoking increases the risk of developing wet AMD by about 4.1 times. All right, so if you're a smoker, your risk is increased by about 4 times just by smoking. If you quit smoking, you never reduce the risk completely. The risk does get reduced, but only down to about 1 times the risk.
And so smoking, now how about a little bit about, we talked about age, obviously it's an age-related condition. How about race and sex?
Well, this test was basically done on Caucasians. That's how we did our study. We do find that it's pretty accurate with most races. The
prevalence of macular degeneration is much higher, though, in whites, correct?
Yes,
it's basically a white Anglo-Saxon kind of type disease, right? I mean, that's kind of, I think, how it's been explained in the past. So, if you're a white female, it's a little more prevalent in women than men, white female with light hair, light eyes, light skin, we're pretty concerned. And if you're a smoker and overweight, we're pretty concerned.
Double whammy, right?
Folks, we're just about at the end of our first segment. What we're going to do in our second segment is we're going to talk specifically about the Macula Risk test and what exactly it is, how simple it is to do, the information you're going to get from it, and how we can help patients even more now with macular degeneration. So make sure you stay tuned. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we'll be right back. Welcome back, folks. You're watching Eyecare Today. Again, I'm your host, Dr. Thomas Kislan. And remember, any questions you have in the Hazleton area, 453-2020. In the Stroudsburg area, 421-3342. Again, I'm happy to be joined today by David Skalky. He's a representative with a company that makes a genetic test for macular degeneration called Macula Risk. And that's what we're talking about today, folks, is if you're diagnosed with macular degeneration, it's extremely important now to understand what the risk factors are for it getting worse. And now we can actually have a way to predict what a patient's risk is for progression. So, Dave, thanks for joining us again.
Thanks for having me.
Explain to the folks out there how this test actually works. This is where your knowledge is so important. So, explain to the folks out there maybe a little bit about DNA testing and what this test actually does.
Well, first of all, it's a very simple test. It's a cheek swab. It's not a blood test. And it takes about maybe 5 minutes to do in the doctor's office, and it has to be recommended by an optometrist. The test looks at 4 different variants of genes. They call them SNPs, polymorphisms. And what we're looking at is 2 complement factor genes and 2 oxidative risk factor genes. And everybody, if you look at your friend, your neighbor, the person next to you, we're all about 92% the same. But we all have variations in certain parts of 4 genes. And those variations determine our sex, our hair color, our skin color, our eye color. Some of those variants give us protection against disease. Some of those variants give us a little bit more predisposition for disease. One of the diseases that we have been looking at is macular degeneration. And we found that these 4 particular genes, complement factor H, CF3, ARMS2, and ND2, are specific for macular degeneration. And when you have the variance in these genes, combined with your smoking history and your age, we've come up with a pretty high predictive test for macular degeneration. And it's about 83% predictive, which is unheard of as far as genetic testing goes.
Yeah, that's amazing. And you made a couple good points. One, it's an easy test. It's not a blood test.
Right.
It's a cheek swab, which is extremely simple. How long does it take to get the results?
Well, we do the test in the doctor's office. The doctor sends the test out, and about 2 weeks later, the doctor is going to get the results back. We usually recommend that the doctor bring the patient back about 3 to 4 weeks after doing the test, just to give us a little bit of extra time in case the test takes a little bit longer. The results come back. It's a very detailed report. It's about 5 pages long. The doctor will review the results with the patient and come up with a plan for the patient as far as possibly taking supplements, maybe coming back to the office more frequently because they're a higher risk patient. It's important that the doctor meet with that patient afterwards to really discuss these options and come up with a plan.
And that's an excellent point, because the one thing we know about macular degeneration, especially the dry form converting to the wet form, is early detection is absolutely the key. We can find a patient, and folks, if you've been to the eye doctor, you know when I talk about the big E, 20/20, all those numbers, if we catch macular degeneration when it's maybe at its 20/30 stage instead of its 2400 stage,
right,
there's a much better chance of preventing it from getting worse and losing vision and going blind. So that's the key, is if a patient is at high risk, one of the things we are going to want to do is see those patients instead of maybe every 6 months or every year, maybe every 3 to 4 months. Because
Exactly.
again, the sooner we catch it, the more important that really is. So that was an excellent point. Let's talk about really how easy this test is. I have one right here. So this is basically the cheek swab. So what we do, and either the doctor can do it or actually the patient will do it themselves. So let's pretend you're the patient. Okay.
It's a clean,
so
it's a brand new
sterile
test.
test. So I open it up, and the patient would actually take the swab out, and I would ask the patient to very gently on the inside of the cheek to go back and forth about 20 times. Good. And then we air dry it actually very gently, a little bit in the air, and then it goes right back into the sterile container.
And that's it.
And then it gets popped into a bag. We put patient's information on it. It goes into this FedEx bag, right out in the mail, and it's gone.
Mm-hmm.
And that's really, folks, how simple this test is. And then again, in a couple weeks, we get the results back. We'll have the patient in, discuss the findings, and go from there. So I guess, folks, what's important here to understand is we have a test now that's very highly predictive. It's a very quick test to do. How much does it cost?
Well, if you don't have health insurance today, the test can be rather expensive. It usually gets billed out to the insurance company for about $1,000.
Okay.
But the good news is that it is covered by Medicare, and most private insurance companies will cover it 100%.
And I think, in reality, most patients who have macular degeneration are elderly, are more senior patients, have Medicare, some sort of insurance, and it is covered by insurance for those patients.
Yes,
So,
it is.
so that's the important thing to understand, folks. Here's an easy test, very simple to do, and we really can get a lot of information from this test. Now, let's talk about when this test comes back now. There's different levels of prediction for progression. So explain to the folks out there the different levels.
Well, we take these patients and we categorize them into 5 different risk categories. Risk number 1 and 2 are relatively protected against getting wet macular degeneration. But 20% of your patient population is going to be in risk number 3, 4, and 5. And it's those patients that you really need to focus on, talking about doing supplements and definitely coming in more frequently for more diagnostic testing, to follow them a little bit more closely to make sure that you catch them right as they're going wet.
So a patient who's a stage 3 risk factor versus a stage 5, I guess, what we're going to have to decide with the patient is maybe, again, instead of seeing the patient every year, we're going to now see that patient every 6 months, maybe every 4 months. And I think it really depends on what their retina looks like also.
Absolutely.
This is a piece of the puzzle, folks. It's not the only thing we use to determine maybe how often we need to see the patient, if we're going to use supplements or not. But I think, the message we can take from this is we now have another big piece of information to really help patients out there with this condition. So, our take-home message today is, one, good diet is important, because there is a higher risk. We've now seen a relation between cardiovascular disease, macular degeneration. If you still smoke, please quit smoking.
Yes.
Again, stay healthy. Get to your eye doctor on a regular basis, so if this is something that's diagnosed, we can deal with it. And supplements, folks, you've heard me talk about the importance of omega-3s, lutein and zeaxanthin. I've talked about the physician-recommended nutraceutical products. They have products that were actually developed by Will's Eye down in Philadelphia. Dr. Mitch Feynman, Dr. Alan Ho down at Will's helped develop these products. So the omega-3 product and the antioxidant product is extremely important in helping patients with macular degeneration prevent this condition from getting worse. It's an antioxidant supplement, things such as vitamin C, E, zinc, copper, and the B complexes. So these are extremely important supplements. All right, folks, we're going to take our second break here, and when we come back from our break, we're going to talk about the importance of really saving the second eye in someone who already has vision loss in the first eye with macular degeneration. So again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we'll be right back. Welcome back, folks. Again, you're watching Eyecare Today, and I'm your host, Dr. Thomas Kislan. And for any questions, remember you can contact either office. Our office in Hazleton, the number is 453-2020, and in Stroudsburg, the number is 421-3342. And always catch us on the web at www.drkislan.com. And I'm happy to be joined again by David Skalky. He's a representative for a company called Macula Risk, who makes a new genetic test for predicting the progression of macular degeneration. So Dave, thanks for joining us again today. The last two segments we talked a lot about macular degeneration, what it is, how we can predict if it's going to progress for a patient, and if it is going to progress, what we can do. Let's talk now about really what happens when a patient goes to the doctor with vision loss from macular degeneration. Because let's really be honest, a lot of patients, even though they should go to the eye doctor every year, they don't.
Right.
And all of a sudden wake up one day and boom, I can't see out of one eye.
Right.
So they call the office, they come in, and what do we find?
It's so true. I mean, patients today, they really don't know what's happening until they cover one eye and look at something and they see wavy lines. And so they'll come to the doctor, and I would say probably about 60 to 70% of the patients that you send to the retina specialist already have devastating vision loss. And, the retina specialist looks at that vision loss and they say, okay, we could stop it right there. We can't get it any better. But at least while we're stopping that eye, let's at least keep an eye on that second eye so we could just monitor that. And most of the time they catch that second eye as it's going wet, and they could stop the second eye. So here's the key to this whole thing, is that you as the doctor can monitor these patients more frequently by knowing their risk level and catch that first eye before it starts going wet, or as it's going wet, get them to the doctor immediately and start treatment before they have any devastating vision loss.
And that's so true. I see patients all the time. They come in, that first eye's all blurry. It's devastating to tell a patient, there really might not be much we can do. but you're still 20/20 in your other eye.
Right.
That's basically, we got one spare tire left, and sometimes I think that's why God gave us two eyes. But, we got that one spare tire that we have to work with now, so we want to do everything we can to prevent it. And what are some of the statistics out there as far as preventing vision loss in that second eye?
Well, I think that when patients present with the vision loss in the first eye, it's probably about 92% of the time they can preserve the vision in that second eye.
That's great numbers.
Yeah, it is great numbers, but it would be lovely if that 92% could be in the first eye too.
Right.
That would be a great thing.
And I think that's where this test comes in for those patients that do routinely go to the eye doctor, and we maybe early see the signs of some macular degeneration in both eyes, and we do this test. And again, folks, for maybe who are just tuning in, what we're talking about is a test called Macula Risk. And this is a genetic DNA test that can predict how fast macular degeneration is going to progress from one eye to the other, or I should say just in general, how fast it's going to progress. And again, David, tell folks out there why that's important.
Well, I think in treating macular degeneration today, most people lose vision in one eye, and then with the wonderful drugs that we have today, we can stop it, and it can be very effective. This test really does stratify these patients into different risk categories, so the Dr. Kislan, can actually monitor those high-risk patients more frequently, possibly get them on supplements, tell them to stop smoking, watch their BMI, their body mass index, make sure that they're on a better diet, and maybe stop this from getting to that point.
And again, maybe for patients who are just tuning in, I want to show how simple this test is, because when we talk about doing tests, patients always say, oh, I have to do that test again, or the visual field test they hate doing in the office, or blood tests, patients don't like to do. But let's look at how simple this test is. And this is all there is to it, folks. It's a cheek swab. Takes seconds to do. We open this sterile container, and I'll actually ask the patient to take it out, and I'll ask them to very gently swab about 20 times on the inside of their cheek. And then once they do it, we very gently kind of air dry it for a couple seconds. It goes right back into the container.
Simple.
It goes in a container with the patient's name and all their information. Goes into a little FedEx bag here. This goes along with the signed consent that the patient does, saying it's okay to do the test, along with their insurance information, and it goes to the company. And then when do I usually get the results then? About how long after?
They come faxed to you and mailed to you, probably in about 2 weeks.
Okay. And then at that point, folks, I'll have the patient back. We'll go over the results of the test and make any recommendations from there. And let's also just review the different risk categories. There's level 1 through level 5, correct?
Exactly. What we look at are different genetic polymorphisms, and it stratifies the patients into 5 different risk categories. 1 and 2 are relatively low risk. 3, 4, and 5, which will be about 20 to 30% of the patients that you're going to test, will be higher risk. And those patients you're going to want to see more frequently. The 3s, you're going to probably want to see about 2 times a year. The 4s about 3 times a year. And the 5s about 4 times a year.
And the key to seeing patients more frequently is that we, again, catch any changes before they really cause vision loss and make the proper referral to the retina specialist. So, folks, just to kind of wrap things up, we're talking about a new genetic test out there that can help predict the progression of macular degeneration, save vision in patients. It can help us predict how often we need to see patients. Again, really hammers home the message about how important nutraceuticals are, how important it is to quit smoking, watch your diet, weight, things like that. So we went over a lot of information, folks. If there's any questions, please feel free to contact any of our offices in Stroudsburg, 421-3342, in Hazleton, 453-2020. Again, David, thanks for joining us today and sharing your insight with the folks out there. And folks, again, time went quick, but again, if there's any questions, let us know. Again, I'm your host, Dr. Thomas Kislan. You've been watching Eyecare Today, and we'll see you next time.